Well, COVID cases are surging after the holidays, and it is time for our weekly checkup with Santa Barbara County Public Health. The Director of Public Health, Vondo Reynoso, is on with us via Zoom. Thanks for joining us. We have a lot to get to today. I want to start with testing. All of Santa Barbara County has 4 places to go get a test right now that are posted up on the Public Health website. There's a Santa Barbara testing trailer. Next appointment is January 19th. The LHI Direct Relief site has one for January 12th. Lompoc doesn't have an appointment until the 13th. Santa Maria has one on Sunday, January 9th. We've seen a lot of long testing lines, people waiting hours for a rapid test at La Cumbre on Monday. What is the problem with testing? How are we still at this point?
Good morning, Joe. We are at this point because the demand outpaces the supply, which is a good thing. Our community members are realizing that they need to be tested in order to stop the transmission. What I can tell you is that in response to the increasing demand, Public Health will be expanding our hours at our Santa Barbara testing trailer starting this Saturday. First time ever, we will be open on Saturday and Sunday from 7 a.m. to 7 p.m. And again on Wednesday, starting on Wednesday, January 12th through Sunday, January 16th, again, 7 a.m. to 7 p.m. So appointments, community members have to schedule their appointments, and we will be giving the PCR tests. But the other thing too is, Joe, that we are requesting a significant number of at-home antigen test kits from our federal HRSA funder, and we anticipate receiving these kits in less than 2 weeks, and we'll be coordinating with our county partners to distribute these kits throughout the county.
Why wasn't this anticipated, though? I mean, after every holiday season, no matter what it is, whether it's Christmas or 4th of July, there's always a spike. We knew Omicron was circulating. Why not be better prepared right directly after the holidays instead of 2 weeks from now when we're going to get more tests, which, I mean, the peak could be over by then.
Right. Great observation. The shortage of testing is a national problem. It's a state problem. And our supply chain from the federal government wasn't available to order until this week. And when we did receive our state allocation, we immediately turned around and offered that to our community and quickly distributed about 14,000 antigen tests in one day. So again, I think that it is a national problem where we did anticipate it, but community members were very worried about Omicron. And yes, after the holiday surge or the holiday gathering and traveling, the demand was just exceeded beyond our capacity. And we're seeing this across the state and across the nation.
Public Health closed the Goleta Valley Community Center testing site. Why? Wouldn't it be better to keep all sites open?
Yes, so another great question. So we had the contract ended with the state and the Goleta site early in November. And so it was just the timing of it. In response to that closure, we expanded the site at Direct Relief. So that is a 12-hour day. And with that expansion of a 7-day coverage, 12-hour day between our Santa Barbara and our Direct Relief site, the gap is covered.
Schools and testing is another hot topic right now. Santa Barbara Unified actually had to pull staff from their administration building to go cover classrooms where teachers were out. The governor's office said yesterday that since December 22nd, 6.2 million tests were distributed to education offices across the state. Are those going out to teachers and students? And how can they get a test quickly and get back into the classroom?
So the state is distributing at-home antigen test kits directly to schools, and our school partners are pushing them out to staff and students. And in addition to that, school districts have testing sites both at Allen Hancock and at Earl Warren for the PCR testing. So staff and students and their families do have increased access to testing.
Omicron, have we seen more cases, and how is it impacting our hospitals, or is it?
Yeah, Omicron is rapidly spreading throughout California. We're seeing it reflected in the surge of new cases, the increase in testing positivity. Surveillance data indicate that 79% of sample cases were Omicron, as reported by CDPH. And CDC yesterday projected that it's at least 95% for our Western region. So Omicron is here in our community.
Locally, you guys had only identified. Locally, you'd only identified like 5 cases a week ago, right? How's that even possible?
That because of the incredible transmission of Omicron, it's wildfire. Yeah, so our biggest worry right now is how the surge in cases will affect hospitals and deaths. We anticipate increases in hospitalization, but we also worry about the impact to the healthcare workforce, people becoming infected and hospitals not being able to respond. And Public health is closely monitoring the impacts of this current surge to our healthcare systems, and we will be reporting that out on a weekly basis and daily basis as reflected on our community dashboard.
All right, we're going to get you out of here on this. Quarantine rules. Man, this has been bungled so badly by the CDC. What are the guidelines? They say you got to quarantine for 5 days if you're asymptomatic or mildly ill. You don't need a negative test, but then they contradict themselves and say, hey, if you have access to a test, sure, go ahead and take one, and they continue to isolate for 10 days. Why is it so confusing? And what the hell are people supposed to do if they do have COVID and they need to go to work and they can't get a test?
Right. It is CDPH. Santa Barbara County is following CDPH guidelines that say that absolutely, if you've been exposed and you are testing positive, you are asymptomatic, you can test out of quarantine on the 5th day. And if you are fully vaccinated and boosted, same thing. However, if you are not fully vaccinated, you are eligible for the booster shot, but have not, you need to observe the quarantine rules. You know what?
And you see how it's confusing, though, right? It's very confusing. I mean, our newsroom has been wiped out. We have people that are missing because they're asymptomatic or they have very mild symptoms, but they can't be here. I mean, COVID is everywhere. I must know 20 people right now that have COVID, but nobody really knows what the rules are. I mean, it's got to be made simpler by public officials to help them.
Absolutely. And for that reason, if we have pushed that out on social media, and if there are any questions, it is posted very clearly on our website. In addition to this, the newly pushed out isolation and quarantine guidelines are not for healthcare workers, nor for K through 12. And so there's actually additional guidance that CDPH will be issuing in the days to come to add on to the complexity.
Yeah, they don't make it easy on anybody, for sure. One last thing, rapid tests. I know a lot of people are taking them at home. You guys don't necessarily get that data unless they report it, right? So could the number of cases be much higher?
Yes, absolutely. Because it is not a requirement for people to report the positive at-home antigen test. We anticipate that there are more positives out in the community, and we'll trust that those who are positive will safely isolate and will inform their contacts to quarantine.
All right, Vondo Reynoso, there are a lot of tough questions, and I appreciate you answering them as best as possible. We thank you for your time, and we will talk to you next week.
Bye, Joe.